Well, the interesting thing about TAVR is we started with a group of people hardest to take care of. In other words, they wanted to prove the technology by doing it in sick people who weren't a candidate for surgery. That was the first group, not a candidate for surgery at all. So that consisted of a lot of octogenarians and people that had complex other diseases and had been turned down for surgery. And they had to be turned down by 2 surgeons. And they had to have a specific risk using this model we use, the STS. The next group of patients was a so-called high-risk patient. And the high-risk patient is a patient who's at high risk for surgery and who is a suitable candidate for TAVR. In other words, they have to have some features in their heart, or they can't have other features that prevent them from having it. And TAVR is therefore a relatively complicated selection process. And those criteria were determined by the FDA and supported by the company that supplies the valves and some of the expertise. Most of our patients are referred by cardiologists. There was a time when an awful lot of the patients who came here were actually referred by primary physicians. It's often and I think we should really reach primary physicians and patients, because we know, again, across the board, many patients are not seeking or not being told to seek surgical care or even intervention with TAVR until it's too late. TAVR has refocused the country on aortic valve disease, and it's kind of exciting because the risk when you're healthy of an aortic valve replacement is really very low, with or without TAVR, an open procedure. And the other thing is, it's remarkable, is the incision in the midline that seems so ugly because it's the bone in the middle, is not very painful, and these patients can go through procedures without any substantial discomfort, a regular open procedure if they're given enough pain medicine. Unlike back surgery, which I've had, it's not terribly important to anybody that you not have pain. They say, well, pain will keep you from hurting your back. That's good for you. Sit still, don't jump around. In this case, we want the patient to have very little to no pain because we want them to breathe and cough and be active. So I honestly think the single most important issue is TAVR can be a minor miracle, but in the absence of you being a candidate for TAVR, is that the procedure in young people can be relatively painless by comparison to other operations, and the patient does extremely well if they have reserve.